Pilots also train for extreme conditions, and they don't do it with a real plane and with real passengers. The same thing we should be doing in surgery. We should be training for extreme conditions. We should be training for our surgery ahead of time. The way this is done is with cadavers, and cadavers are brought from faraway places, and you don't always get exactly what you want to get with regard to the age of the patients and how the bone is. We can actually simulate exactly what we're going for. So we can design the models and they can be printed to simulate specific pathologies in specific age groups with specific types of bones. It started off with the basic building blocks of simulating the real feel of cortical bone and what the medullary canal feels like and what cancellous bone feels like. And from that developed into simulating long bones, for example, the femur bone and other bones such as the vertebra. Once these basic building blocks were designed and simulated, then we can put these parts together, for example, in the lumbar spine in order to simulate that whole look and feel of spine procedures, for example. So surgery is something that's very visceral. It's a feel. I know what it feels like when it's realistic. It's not just about the way things look, it's how they sound in surgery and the correct tactile response when I'm using the surgical tools. When working with these new models, you get that very familiar feeling in surgery that I haven't had before in surgical training with different surgical models, and this is a brand new experience. I think surgeons will relate to this in that sense because it will feel like home for them. It feels like surgery that they're used to doing.